Hi guys, this is Group 8, Katie, Jillian, and myself, Jace, and we're going to talk about methamphetamines and the effects on the human brain. So pretty much the overview and physical properties. Some common street names is meth, crystal, ice, and crank. It typically appears as a white, odorless, crystallized powder or bluish white crystal shards. The routes of administration are orally, smoking, snorting, and injecting. Smoking and injecting administration produces a faster effect, increasing the risk of addiction. So for the pharmacological profile and legal classification, meth is a Schedule 2 controlled substance, indicating a high abuse potential with limited medical use. The half-life for meth is approximately 12 hours, with effects lasting between 6 and 12, depending on the administration route. The dosage typically between 5 and 60 milligrams for medical purposes, and then illicit doses are often much higher. So for the effects of meth, there are 3 different stages. The first stage is the rush, typically between 5 and 30 minutes. The second stage is the high, between 4 and 14 hours. And the third stage is the crash, that initially starts to wear off. For the chemical and pharmacological properties, the mechanisms of action increase dopamine and release and blocks reuptake, leading to intense euphoria and increased energy. The chemical category classified as a synthetic stimulant derived from amphetamine, known for potent effects on the central nervous system. So for a healthy brain not on meth, it is comprised of a complex organism and specialized regions that work together to perform essential functions. Efficient interaction in a healthy brain regions like neuroplasticity, the brain adapts and forms new connections, optimizing the response to new experiences and learning. Healthy interactions among these parts depends on proper blood flow, nutrients, and the efficient release of neurotransmitters. Under normal healthy conditions, the temporal lobe, as shown above, retrieves stored knowledge and patterns, is in charge of processing auditory signals and smells. The frontal lobe generates ideas and evaluates solutions. And the prefrontal cortex analyzes solutions, regulates emotional response, and makes decisions. I'm going to pass it to Katie now to talk about a brain on meth.
Hello. Okay, so the brain on active use of meth affects the frontal lobe, which can lead to risky behaviors, poor decision making, the temporal lobe, which affects memory formulation, retention, and can lead to cognitive deficits. The parietal lobe, which can distort sensory perceptions, leading to hallucinations or altered awareness of bodily sensations. And the occipital lobe, that can cause visual disturbances and impairments, such as blurred vision or hallucinations. So structural and functional brain alterations of meth use. Long-term meth use leads to significant structural changes, mostly affecting cognition and emotional regulation in the frontal and temporal lobes. It also damages the white matter integrity, impacting neural connectivity and overall brain communication pathways. Brain volume alterations of meth include reduced gray matter in the prefrontal cortex and the hippocampus, associated with impairments in decision making and memory, and white matter in degeneration in pathways, connectivity between regions, like discussed earlier, which affects cognitive and motor impairments. The regions of the brain activated by meth use are the amygdala, which contributes to increased emotional reactivity and anxiety, and the hypothalamus, which leads to change in stress response and compulsive behaviors. So this is a side-by-side picture of a healthy brain versus a meth brain. As you can see in the picture, the healthy brain versus the meth brain, the damage in the meth brain is in the white matter and you can see the atrophy that has occurred with prolonged use of meth. This has resulted in the degeneration of cells over time. So neurotransmitter pathways and cognitive impairments. The transmitter pathways affected are, for one, dopamine. Meth acts as an antagonist, and leading to excessive dopamine release. This induces euphoria, but it does lead to neurotoxicity over time. The others are serotonin and neuroepinephrine, affecting your mood regulation, and symptoms of anxiety and impulsivity are going to be increased. Neurocognitive pathway alterations for chronic meth use include deficits in the reward and executive function pathways in the prefrontal cortex, which does compromise impulse control and decision making, also affecting the neurocognitive pathways, showing reduced functionality in memory, learning, and emotional processing. The functional impact on cognition of meth induced changes impair memory, attention, and problem solving, with deficits often persisting even after the drug, even after someone has quit the drug. Okay, so blood flow and metabolic changes include an increased blood pressure and heart rate, creating strain on the cardiovascular system. The vasoconstriction narrows blood vessels, reducing blood flow to organs and increasing cardiovascular risk. And the blood-brain barrier raises permeability, allowing more toxins into the brain, leading to oxidative stress and inflammation. Detailed release and uptake inhibition. The mechanism, methamphetamine does stimulate your dopamine release while inhibiting reuptake, leading to intense euphoria and reinforcing addiction. Neurotoxicity. Excessive dopamine levels cause oxidative stress, damaging dopamine receptors and resulting in long-term deficits in reward processing. Impact on other neurotransmitters. Serotonin and neuroepinephrine is increased in serotonin and neuroepinephrine levels contribute to mood dysregulation and heightened arousal. Glutamate toxicity. Meth overstimulates your glutamate pathways, resulting in excitotoxicity and brain cell death, particularly in your prefrontal cortex. And then memory and social effects. So short-term memory, it's obviously, meth definitely impairs your short-term memory, leading to difficulties in recalling recent information or performing any daily tasks. Long-term memory, any prolonged use is going to lead to long-term memory, retaining long-term memory, especially affecting autobiographical and spatial memory. Some effects on social and interpersonal behavior. The DSM does indicate that methamphetamine use disorder is associated with social withdrawal or isolation, aggression, reduced empathy, and it often leads to strained relationships. Interpersonal impairments definitely increase impulsivity, irritability, and irritability contribute to challenges in maintaining stable social and family relationships. Okay, I'm going to send it over to Jill to talk about the impact on executive functioning.
Okay, methamphetamine affects impulse control. It's going to impair areas in the prefrontal cortex, which are responsible for executive functioning, like impulse regulation, which leads to high-risk behaviors and also poor decision making. When people are using methamphetamine, they are more likely to engage in behaviors without considering long-term consequences, and this is going to increase the risk of relapse and also legal consequences. Methamphetamine also affects decision making, which is going to reduce their ability to be able to evaluate risks and set goals. And it also impacts the frontal lobe, those prefrontal cortex pathways, which is going to impair goal-directed behavior and also critical thinking. When the brain is withdrawing from meth, there are a few lobes and systems that are affected. So during withdrawal, the frontal lobe is going to be affected, and individuals can experience difficulties, cognitive difficulties, including concentration, increased impulsivity, and also challenges in planning and goal setting. The temporal lobe is also affected, and this is going to contribute to memory deficits and also emotional dysregulation and disturbances during withdrawal, which is going to cause anxiety and depression. The parietal lobe during withdrawal can lead to altered sensory perceptions and also difficulty in coordinating responses to environmental stimuli. In regards to the occipital lobe, during withdrawal, there can be changes in visual perception, which can lead to visual disturbances or heightened sensitivity to light. In the limbic system, during withdrawal, there can be heightened emotional responses, cravings, and also mood swings. Cognitive and physical alterations. Memory and attention are affected by methamphetamine. Users experience impaired attention, working memory, learning, and it affects executive functioning skills like planning and problem solving. There's also significant cognitive decline caused by methamphetamine use, cognitive deterioration, and this can persist even after cessation and through withdrawal. There's also a cardiovascular impact from methamphetamine use, the increased heart rate, blood pressure, and risk of heart disease due to vasoconstriction. And again, these are long-term health deficits, even through withdrawal and chronic through the rest of their lives. Methamphetamine also induces neuroinflammation, oxidative stress, and damage to brain cells. Developmental impact and behavioral challenges. Methamphetamine use during adolescence can disrupt normal brain development, particularly in the prefrontal cortex, like we've talked about, which is responsible for cognitive development, and this can lead to long-term cognitive deficits. In regards to physical development, chronic meth use during growth periods can also impair bone and tissue health and development, which is going to impact overall physical maturation. Behavior changes in social functioning. Methamphetamine can cause increased aggression and risky behaviors, including impulsivity and then also risky sexual behaviors. Methamphetamine users also experience social withdrawal, relational conflicts, increased irritability, which can affect their social life and integration. Tolerance, independent, and addiction. Users of methamphetamine experience both psychological and physical dependency, which can lead to a high risk of relapse and chronic use patterns. Tolerance, repeated use increases tolerance, and so the user is going to require higher doses for the same effects, which can accelerate health risks and also increase the risk of overdose. With chronic methamphetamine use, there's also a higher risk of tissue dependence, which is going to cause the withdrawal symptoms upon cessation, and some of those symptoms are fatigue, depression, and cravings. And here are our references. Thank you so much for listening and watching our Build a Brain presentation.